So I'm just going to do the introduction. Okay, so today we're going to start a class. I'm going to be talking about schizophrenia and the symptoms. The format of this class, we're going to review each of the criteria, and I'm going to be talking about my personal experience and my opinions about each of these criteria to clarify the understanding of this diagnosis. I want to make a comment that schizophrenia is one of the most serious mental ill disorders. It's chronic for the most part, and it has an early onset around college age, but we can see it much earlier in adolescence. Even though it's a rare disorder in adolescence, we can still see it from time to time. And usually in adolescence, will fulfill most of the diagnostic criteria of schizophrenia. So we're going to start, we have some students here that are going to help me review this topic for this class. I'm going to start by reading the diagnostic criteria for schizophrenia, which is categorized under the psychotic disorders. By the way, there are different psychotic disorders that are not necessarily schizophrenia. Schizophrenia is one of them. There is another one called schizoaffective disorder. Any other disorders you remember? Maybe into the psychotic disorders? Schizophreniform disorder. Mm-hmm. And the other?
The acute or brief psychotic.
Brief psychotic disorder. The schizoaffective disorder, which can be categorized into two types of schizoaffective disorder. One is the bipolar types, and the other one is the depressive type. And then there is another one that is called psychosis, NOS, basically when the person comes in with acute psychotic disorder, still haven't been diagnosed, but they meet full criteria of a psychotic disorder, then will be psychotic disorder NOS, until they meet the time criteria for another psychotic disorder like schizophrenia. And we're going to go over now the schizophrenia because we think is the one that represents more clearly the psychotic disorder. And it's chronic, and the diagnosis needs to be made very accurately to start treating as soon as possible the psychotic disorder of the schizophrenia as a symptom. Right? Let's go over with the diagnostic criteria.
So it says 2 or more of the following, each present for a significant portion of time during a 1-month period. The first one is delusions. Second one is hallucinations. Third is disorganized speech. Fourth is grossly disorganized or catatonic behavior. And the fifth is negative symptoms.
So there are 5 symptoms that the patient needs to have. It has to be at least 2 or more of these. And usually if you see a patient, like most of the diagnostic criteria of mental illness, if a patient comes in with a disorder, will meet criteria for more than 1 symptom. Usually it's easy to find 3, 4, or all of them, you'll see in these patients. So it's not uncommon to have all these symptoms come out and meet criteria for the full 5 symptoms. Rarely you'll see only 1 symptom or 2 symptoms. So we're going to go over each of these symptoms. I'm going to be making some comments on these symptoms and open up for discussion and questions as well. So the first symptom is hallucinations and delusions.
Mm-hmm.
So let's start with what's a delusion, to clarify that.
Fixed false belief.
A fixed false belief?
Mm-hmm.
Okay. Any other comments with it?
They made special note, it goes beyond just a fantasy, it's like a firm belief that this is what's happening, and it's, like I said, false.
And one of the most common or more critical or classic symptoms of schizophrenia is the bizarre delusions. And any example of what a bizarre delusion could be, to clarify it?
Something planted in their head.
Something.
Like the government planted like a microchip or something in their head, something.
Absolutely, that would be a good description. For example, the government has implanted a GPS device in my brain when I was having a dental surgery, and they gave me anesthesia. So now I have these in my brain. They can follow me around. They know exactly where I am. They can hear my thoughts. So you see, now they have the delusion on it. It's very fixed. You can show them CAT scans of their brain, and they still won't believe you. So you show evidence that, on the contrary, that this is false, it's not real, and they will still continue. So it's very fixed, wrong, false belief. So that's the delusion. And so what other delusions can you think of?
I'm the president of the United States, or, you know, I mean, there's
Grandiose.
there's lots of different delusions that can
Right.
fall into that.
So a schizophrenic person can present with any kind of delusions. They can present with delusions that may be real, you know. For example, let's give an example of a delusion that can be real.
Have cancer.
Or something that, right, they may be confused with real, and maybe you need to really rule out if it's real or not. You know, I have a cancer,
Somebody's trying to poison me.
somebody's trying, yeah. So you have the somatic delusions, I have cancer. There's somebody's trying to poison me, that may be paranoid, you know, but you still need to explore. What if you have an elderly person who's very wealthy, and they come up to you and say, you know, my granddaughter, my cousin, is trying to get on my estate, and they're trying to force me to sign, and she's very wealthy. You know. So those things happen in real life. You know. So then you need to be very careful. Now, when it's a classic bizarre delusion, it's right there. It gives you a diagnosis. So if the person truly believes that, then you know that would meet that criteria, fulfill the criteria. However, there are other times when you need to rule out whether this is true or the person is malingering. Because anyone can really, you know, malinger or mimic, say, I have this, you know, I believe this is completely made up. You know, it's not what they really believe. So it has to be a real belief on it. So we covered the delusion, so there must be a delusion, that's the criteria A. And what else?
Hallucinations.
Then we have the other one. So it has to have, so these patients need to meet both criteria. They need to have delusions and hallucinations to meet the criteria. If they have one isolated, it will not meet the criteria for the diagnosis of schizophrenia. It may meet the criteria for something else. To give you an example, if a person only has delusions, nothing else, no hallucinations, no other criteria for schizophrenia being met, then what do we have right there? How would you call that symptom? What disorder would that mean? So would that be a psychotic disorder?
A brief psychotic, depending on how long it was. And
Yeah, suppose
And it just
9 months,
Delusional
Yeah,
disorder?
delusion.
a year. What is it?
Delusional disorder?
Exactly. So you have one category that will explain it is a delusional disorder. That's all they have. It's a fixed delusion. It's not going to change, but they don't have anything else. There hasn't been in the past hallucinations. They don't have disorganized thought process. They don't have block process. They don't have negative symptoms. They don't have speech problems. You see, they're very well put together, very well organized. But they have that delusion. And most of the times it's really hard to find out, pinpoint, because they present so well. I mean, they can be highly functional persons. But if you meet that specific topic, you need to bring that topic so they can start talking about it. You see, so it's really hard to say, because they're not going to bring it to you if there's no need to. So, but if you start talking about something that may gears towards it, then you can find that. Okay, so just delusions alone can meet criteria for a psychotic disorder, but it's going to be called a delusional disorder. What about hallucinations alone? You have a person that has only hallucinations, nothing else.
can they be classified as schizophrenic?
Yeah, schizophrenia or psychotic disorder.
A brief psychotic
Yeah.
episode?
Hmm?
To be a brief psychotic episode?
Really psychotic episode. Well, imagine this person tells you that every time she hears colors, you know, she hears colors. So there's music, but then the music starts bringing colors. And one specific note will bring one color. So if she goes to see a concert, she's going to start seeing colors flying all around. You know? So
You have to rule out.
is that a delusion? Is that well? Would that be a hallucination? What would that be?
I think it's a
Yeah,
hallucination.
I think that would be a hallucination, wouldn't it?
That would be a hallucination. Yes. But you know, they know they're reality based. They know that other people can see it. But you know, that's it. So In reality, that's not going to be psychosis, because psychosis, they need to have, by definition, need to have a loss with reality. So they cross that threshold between what's real is not real.
You have to have them independently, the delusions for a period of time and also hallucinations with that as well.
Yes. In other words, hallucinations by itself will not meet criteria for psychosis, especially because psychosis needs to be reality. It has to be, the barrier of reality has to be crossed into, the psychotic world, which is completely bizarre, and that's what led to this diagnosis. The loss of touch with reality. With a delusion, it's very clear, because you give proof of evidence and they still believe it. With people who see colors, for example, they know that they are gifted or they're different because they see it, but nobody else sees it. So they have insight into it. So it's not, it's not that they lost touch with reality. They know that they are the only ones who see it, and it's not real. However, there is one exception to this rule. When there is one type of hallucinations